So thank you all for being here today. Just by your presence, I'm sure that many of you either have worked with somebody who has memory loss or personally experienced somebody who has memory loss. Just a show of hands, is that why you're here? Yeah, we're seeing a huge increase in it. So thank you for being here today. I brought handouts. The most important one is a survey. Today I am using you as my guinea pigs to collect some data. So please help me do that, and we'll get to that at the end. So for me, it's amazing. Our keynote speaker was incredible. I did not go to Harvard. I went to St. Cloud State. So bear with me with my state education. She's a hard act to follow. But what I have done is worked in the field of aging for a very long time. For the past 16 years, I've worked with many seniors professionally, and personally I had 2 grandparents with dementia, and experiencing those transitions and those decline, this is a very personal disease. And so I'm here today to just share a little bit about what's going on with our state, how you can get involved, and just some resources. I'm not going to go in depth about the pathology and the disease progression of dementia. This is about community resources, because as you start seeing an increase in your clients or patients who have memory loss, they are going to think you know everything, and they're going to need some resources. So by the end of my presentation today, I hope I can connect you with some of those. So we shared a little bit about who I am and who I work for. In the state of Minnesota, we have 7 area agencies on aging throughout the state. And we have 3 basic functions, but our primary goal is senior independence and connecting caregivers to resources. We need our seniors to stay active and healthy and continue to become engaged in the community. We have 3 main functions, one of which is Senior Linkage Line. I hope everybody's heard of Senior Linkage Line. It's the statewide resource line. If you have a patient, if you have a family member, or if you have a friend and they don't know where to start looking for resources, Senior Linkage Line is a statewide line. I have some handouts and some brochures. That's the initial place to direct somebody if they have a question, comment, or concern. The second aspect is we distribute funding to our regional partners from the Older Americans Act. So many services like Meals on Wheels, senior dining, caregiver supports. We have some evidence-based health and wellness programs. Those all come from the Older Americans Act. And so in each of our regions, we distribute quite a bit of money. In our region, it was $2.5 million last year. And then we also have community development, which is where I work. This thing is a little off, but bear with me. So as you can see, that's our region. In the back of your handout, if you're interested in getting connected to a local partner, I have the contact information of what area agency on aging region you would fit under as well. Just a little bit more about Senior Linkage Line. As I mentioned, if you walk away knowing one thing, I want you to know what this number is, and that if you have a patient, again, or a family member that has any questions about Medicare, insurance billing, maybe prescription drug coverage, you can call this line and they will help walk you through, help walk your patients through those processes. The call centers are all regional, so they're real people at the end of the line. It doesn't get routed. That's a big concern when you're working with seniors, that they're going to be sent to another call center, then they're going to go through a bunch of different people. So please take that away, and it's just a great resource for the community. So one of the reasons I'm talking about dementia today, and something that we talk about frequently, is that our population is aging, and Dr. Seymour did an incredible job saying that globally, we're seeing an increase in age within our population. Our country is aging, and that's a good thing. That's a positive thing. But there's some negative connotations when we're talking about aging. We hear a lot of tsunamis, waves about the baby boomers, and I'm boycotting that. No more age waves. We want to be positive about this increase in our aging demographic. So in our state, in Minnesota, we will have 60,000 Minnesotans turn 65 this year, and every year until 2030. 2030 in my aging world is our big year because that's when the baby boomers will start to turn 85. And when you think of the age of 85, you're going to think they'll probably need some more resources. Our chronic health conditions may increase, more people will be impacted, but it means no matter where you work, you're going to be impacted by this increase in our aging population, either professionally or personally, because you will have a neighbor, you will have a family member, or you will be a caregiver of an older adult. So yes. So why am I here today? You know, I love this conference so far because you're bringing people from different facets in to speak with you, the oral health community, about things that we're very passionate about. And dementia or memory loss really impacts the oral health community. And you're a sector that in aging, we haven't really included much in the past. So we're gonna change that starting today. So something I want you to think about through this presentation, and please in the survey, I want you to write notes if you're thinking about what is needed within the oral health professional community to better support individuals living with dementia. I want all your ideas because I'm going to take them back to my colleagues and we're going to see how we can better support and engage the oral health community. So just a little background about why I'm here today, and I'm going to be talking a little bit more about this Act on Alzheimer's initiative, is in the small community of Princeton, Minnesota, I had a conversation with a very small town practice doctor who had inherited his practice from his father. So this is like a 75-year practice. And him and I had a conversation and he said, Emma, I want to share a story that through my practice, through my father's practice, I've had the same patients since I was 23 years old. And when you live in that community and you see the same people, you get to know them through their teeth. And I was like, oh, well, can you explain to me a little bit more? And so what he said is, I've had so many patients and clients over the years that I knew when something was going on. I knew when they were having some memory loss, and I didn't know what to do. Because I could tell through their cleaning habits, their oral hygiene habits, that they were having some decline. Their caregiver was getting anxious, and I didn't know what resources to connect them with. And then when I became a caregiver of my mother, it really became personal. So if you can help reach out to any other local dentist, I would really appreciate it, because we are very close to our patients. Sometimes people see their dentists or go to their dental offices for their whole life. They're very loyal. They could sometimes have the same dentist but change general practice doctors over the years. So that's why I'm here today. I'm sorry if all of you can't see some of this. Let's see. I don't know why it's like that. So just some national statistics. As I mentioned, our population is aging. One of the #1 indicators of dementia or memory loss is age, unfortunately. So right now, dementia is the 6th leading cause of death in the United States, and every 63 seconds, somebody in the US develops dementia. From 2000 to 2015, deaths from heart disease have decreased by 11%. That's incredible. There's a lot of education and outreach about heart disease. But deaths from Alzheimer's disease have increased by 123%. That is incredible. In Minnesota, the 2 statistics that I use, especially when I'm doing big presentations like this, are 1 in 9 people 65 and older have a form of Alzheimer's disease. Uh-oh. Yeah, if you don't mind. That's not my laptop, but we'll go. This is why I bring handouts. I've been in these situations. So 1 in 9 people 65 and older will have Alzheimer's disease. If you look in this room or the people you serve, that's an incredible amount of people. And so that's why everybody is going to be impacted. And 1/3 of people 85 and older will have Alzheimer's disease. So I mentioned that statistic, 60,000 people every year until 2030. 2030, we're going to be having a lot of 85-year-olds that will be susceptible to having a form of memory loss. So right now is the time for you to really know your resources and to get educated and empowered. Something that I really like to mention is the fact that just because you have a form of memory loss or dementia doesn't mean you can't have an incredible quality of life. But early detection is the key. The earlier you know, the better you are to prepare for your future and plan ahead. And so that's why for all of you, we're going to cover some early warning signs, because if you can help connect people and help educate them about this. Okay, I'm just going to keep going. Everybody's going to roll with me.
Nancy's trying to get you a power cord.
Oh, okay, sounds good. Everybody still with me? Okay. So I'll just keep going. So just a little bit about dementia. And as I mentioned before, I'm not going to go into the pathological details of dementia. I want this to be a basic overview because although you are professionals in this room, your patients might not be. So that's why I like to bring in what are some easy examples of how to explain this. Because when we're working in the community, if you work in healthcare, if you work in human services, the people that we serve think you're an expert at everything and think you know where all the resources are. So I just want to provide a basic overview and example. So dementia is a general term for memory loss, and sometimes people get very confused because you hear dementia, Alzheimer's disease, what's the difference? And what I like to say is dementia is just it's an umbrella term for many different diseases. Alzheimer's disease is the most prevalent form of dementia. That's why we talk about it. Something else, and people joke and say, I'm losing it, I'm losing my marbles. But dementia is not a normal part of aging. And so we want to embrace all these people that are going to be aging and living long, fantastic lives. But we want you to know, if there's something else that's changing, we want you to go to your doctor to make sure that it's not a form of dementia. And again, early detection is the key. Although it can be scary, when we think of dementia, do we think of positive? We think of negatives that are associated with it. There's a lot of fear and stigma with memory loss. And so we really want the community to know as much as they can about this disease so they can be empowered and educated. And especially for you, you're forming very long-lasting relationships with your patients, with the people you're providing care for. So if you're noticing some decline, preparing and planning some of those resources ahead of time so that you can give them to your patients or to the caregivers, or if you have that conversation with somebody of, I'm noticing some changes, just so that you're prepared. So, just a couple different warning signs. I get this question a lot. Well, what's the difference? Sometimes I forget things, or I forget where I'm driving to because they put a roundabout in, and it just throws me off when I'm driving. So one of the warning signs is memory loss that disrupts daily life. So forgetting things is normal. Forgetting things that we've recently learned can be normal as well. But when somebody walks into an appointment and it's the third time that week because they're thinking it's a different date, that's when we have some concerns with what's normal and what's not normal. The second sign is challenges in planning or problem solving. So some people may experience some changes in their ability to follow a plan out or work with numbers. That's sometimes one of the key signs. Somebody who has always balanced their checkbook perfectly, and I hear people still do that. They don't just do online banking. But if that's their normal behavior, if they were always paying their bill on time, and then all of a sudden you notice there's a big change in their personality. When I was working with this dentist in Princeton, I asked, what are the warning signs you've seen? And it was with their whole staff, and the receptionist said, that is the number one reason I know somebody has memory loss. Because we've had the same patients for so many years that I know when they stop, they're forgetting, they're nervous, they're coming in, that's when we know something's been going on. And it sometimes can take years of seeing that pattern. We don't want that. We want to help connect people with resources, or help connect you with resources to provide to them. The third sign is difficulty completing familiar tasks at home, at work, or at leisure, things that you've done 1,000 times. So I use the example of baking your favorite recipe of cookies. It's November 2nd, we can think about Christmas. So this recipe that you've done 1,000 times, all of a sudden it gets a lot more challenging. With my grandma, driving to the same places. Somebody's gone to their dentist office 1,000 times. They've gone to this place 1,000 times, and then all of a sudden they can't find it anymore, or they're late. So that's that abnormal behavior of patterns that you've known. It should be ingrained in your memory, but then all of a sudden there's some changes. The fourth sign is confusion with time and place. So going back to this, sometimes individuals who have Alzheimer's disease or dementia, the seasons and the passage of time sometimes get skewed a little bit. So what's normal? Thinking it's Wednesday the third day in a row. Sometimes that's normal. We have weeks like that. What's not normal is not knowing the year and not being familiar with that, or having repeated weeks where you can't tell the difference. The last sign I'll talk about, here we go, is trouble with visual images and spatial relationships that can cause some increase in confusion. And this is having difficulty reading, having some vision problems. Individuals with memory loss, if you've ever been in a memory care, have huge issues with thresholds. So walking across a doorway, especially if there's a change in pattern. So if you go from carpet to tile and you see somebody hesitating, it's because their depth perception has changed. So there's a lot of challenges. The worst pattern that we see the most frequently are those checkered patterns. So the black and white tile that we frequently see in like a restaurant or a clinic. An individual with memory loss can't tell the difference between the black and the white, and they can actually feel like they're going to fall into the carpet, which is really interesting. So just a couple warning signs. The Alzheimer's Association has 10 major warning signs. That's one of the handouts I included, but because of time, I'm going to keep going because we have a lot of content to cover. Oral health and dementia. As I mentioned, I'm not an oral health professional, but I'm an aging professional. And when I worked with this small dental clinic in Princeton, and we had kind of a conversation about what you're seeing, what are the challenges, they talked a lot about the early stages of somebody who has memory loss, and sometimes how challenging it is for that caregiver or the person bringing that individual in to admit that they're having some issues. We want to make sure that you're able to almost care plan with them, because in the early stages, it could really impact somebody's ability to clean their teeth. And in the long run, if you look at how long the disease progression could be, somebody could have dementia for 20 to 25 years. So if they start that decline, it can greatly impact them down the line in the quality of life and their care. So the individual with dementia in the beginning, as they're starting to maybe lose some of their memory or become more forgetful, may need reminders and cues by that caregiver, or figuring out with a family member, especially if that person with memory loss lives by themselves, figuring out what we can do to make that oral health a priority so that they can try to keep their own teeth as long as possible. And then the last thing is establishing an individual long-term preventative care plan for that person. I've spent a lot of my time in my career in the best possible place, which is a memory care. And I absolutely loved it. It's incredible, it's never boring, and you never know what year it is when you walk in. So, but many of those individuals not having good oral health, having misfitting dentures, having pain in their mouth, hugely impacted their quality of life. And when you already are throwing on some memory loss, we don't need to add that to what they're going through. In the later stages, people may lose the ability to clean their teeth or lose interest, and that's why that partnership with that caregiver is so incredibly important to formulate a plan of what do we need to do to help this person. We know where this disease is going. How can we plan ahead right now to help this family? And those caregivers may need training or coaching. Not every caregiver is a natural caregiver. Many caregivers didn't ask for it. Many are family members or even a neighbor. And oral hygiene or helping out with personal cares is not their cup of tea, but it's really important to have those planning conversations. And you know, in the later stages, most importantly, many older adults and individuals who have memory loss can't verbalize that they may have something going on in their mouth because they lose their ability to communicate and verbalize that, you know, I have some pain right in my jaw. You know, they can't say that. So they may have some behaviors. They may lash out. They may, you know, if somebody's trying to clean their mouth, they may swat them away. And that's probably because they can't say something in my mouth is hurting me. So it's really, really important. The last thing is some people food pocket and they have food stuck in the back of their mouth just because they don't know any different. My grandma was known for this. I can't believe how much food she could stuff in her cheek. But, well, it's funny, but you know, it's not great, especially if you're trying to sleep. And it's a choking hazard. So these are all things that we have to think about. The United Kingdom has done incredible things in the relationship of creating a dementia-friendly community. And I loved this quote, especially as I was looking and researching before I came here today. And I won't read all of it, but I thought it was so impactful that each and every member of the dental team plays an important role in the patient journey through their dental visits and help addresses the barriers that they face. I think that's so incredibly important, especially when individuals that you've known, you're noticing some things. We need to make sure that there's no wrong point to get information and resources, because there's going to be a lot of people with memory loss. So we need to empower every sector to know where to turn and make it more comfortable for you to have a conversation with your patients if they start to experience some cognitive decline. There we go. So, Minnesota is an incredible state to age in. And I don't just brag because I work in aging for the state of Minnesota. But in 2009, a coalition formed to start to begin to address what do we need to do to better support caregivers and people who will develop dementia. So they created the Act on Alzheimer's Dementia Friendly Community Toolkit. And it's a volunteer-driven collaboration that led communities to go through a 4-phase toolkit, get people from all walks of life at one table, and move forward to figure out what do they need to do in their community to become dementia-friendly. Each community may have had different goals, may have had different strengths, but it was so successful. It was meant to be a short-term pilot project, and yet today it's 2018 and it still continues. So Act on Alzheimer's was able to fund 40 communities throughout the state of Minnesota. And I was able, again, sorry about this, at the end of your packets, you can see a list of all the different communities. So if there's one in your neighborhood, please, I encourage you to connect with them. Today, there are over 63 communities and growing. In the first 10 years, there was actually grants that communities could apply for. Those grants are no more, but it was so successful that communities have continued to this day. So from this Act on Alzheimer's initiative, the Minnesota model, as it was called, where it brings people from all these different sectors together to work towards this common goal of increasing education and awareness of dementia in their communities. The National Area Agencies on Aging adapted Dementia Friendly America. So they took our model of what worked well here in Minnesota and made it national, which is just so incredible and makes me so very proud. And currently, up to date, there are 30 states that are participating in some form of dementia-related activity, and each state is a little bit different, but they're always looking at what's next. What do we need? What sector do we need to engage? And one of the topics that came up is how are we engaging our dental and oral health community? So right now in Maryland, they have a mobile health clinic that are trained in dementia, and that's about it. So I think we need to do a little bit better, and I think our state, being the leaders that we are, can take this to the next step and maybe possibly develop a model. That's why I said I need all your input on those pieces of paper. I'm going to take this back with me and share what I've learned from you today. So, what is a dementia-friendly community? It seems kind of vague, doesn't it? But a dementia-friendly community is informed, safe, inclusive, respectful of all of those people living with dementia and their families. It has supportive features across all community sectors and fosters quality of life for everyone. An individual who has memory loss continues to live their life. As I mentioned, 90% of people who have Alzheimer's or a form of dementia live independently in their own communities. So they go to the grocery store, they go to the dentist, they go to their doctor, sometimes they drive, sometimes we wish maybe they wouldn't drive, but they continue to live their life, and because of that, if you want a successful dementia-driven community collaborative, you need to include multiple sectors, and that's what made this so successful. So they've had communities as big as St. Paul, Minneapolis, but as small as all the way up in Grand Marais, all the way up in Ely, and as I mentioned before, the little town of Princeton that I work with frequently. So the Act on Alzheimer's Toolkit, and there's an online website, all these resources are listed there. There's no charge, you can access all the documents. They wanted to create a toolkit that every city with a huge amount of capacity or a small amount of capacity could start a coalition and identify what they needed to do in their community to create, again, this ongoing work to become dementia friendly, because it never truly ends. So I got my 10-minute warning. So how can you be involved? Each of these communities I listed has an action team. And if you're interested or willing to get connected, the Act on Alzheimer's website actually lists all these communities and the community contacts. As you can see, there's businesses, caregiver services support, the faith community. I feel like the dental community is a key sector that we really need to work to try to involve more as well. And if you have any additional questions, I'll be here at the end. So from the original ACT model, there were these ACT communities that were involved, but people were asking for more. Okay, our community has become dementia friendly. What is next? So Minnesota was the first to adopt the Dementia Friends program, which is a program out of the United Kingdom. It's a global movement where someone can attend a 1-hour information session delivered by a Dementia Friend champion. Currently, we have around 14,000 Dementia Friend champions in the state of Minnesota. If you're interested in having this educational program at your office, clinic, or just in a small group, you can go online and find a champion near you. They also have a Dementia Friendly at Work program. The curriculum is listed all online. This is what I did with my small clinic in Princeton. We took their whole staff and we basically had a conversation about dementia, and we went over some key things that maybe would help them through their day-to-day practices. And again, help them know what resources to connect with. So I can't leave you without any tips of what to do to have a dementia-friendly physical environment. So the most important one are entrances. So having those entrances be clearly visible and making sure that that signage is marked and at eye level, going on to the signage. Because sometimes people lose that spatial ability and they need cues and reminders. So you may want a sign that says bathroom, but also has a picture. Especially if you have a large clinic, they can be hard to navigate. So just something to think about. The next aspect is lighting. As I mentioned, depth perception can sometimes change. So having really good lighting is key. Flooring, that checkered print, I don't want you to change your flooring, but if you can just know that if somebody with memory loss is having difficulty or you're kind of noticing they're stepping weird, that's something to be aware of. The next aspect, and something that I heard a lot about, is having a family or unisex bathroom. And this is because if somebody can't go to the bathroom by themselves anymore, they may need a care partner to come with them. And so it's just something that is important to think about. The next aspect is noise. That's something that's very hard to change when you maybe have some medical equipment you have to use during some of those visits. But can you put some headphones on to drown down that music? So it's not big changes that you can make to your work environment, but it's small things that can really impact that person's experience while they're at the clinic. So some communication tips is always approaching the person from the front, because you may know them and you may have seen them 20, 30 times, you may be familiar and know them by a first name basis, but depending on the day, you may be a stranger to them. So always making sure you're introducing yourself, because that could be kind of frightening and may cause a little bit of agitation. The next thing is just speaking clearly and being patient. I have a little clock at the bottom, and in one of the activities, it can take an individual with memory loss up to 20 seconds to respond. Typically in an activity, I make you wait for 20 seconds, but I won't make you do that today. But 20 seconds is a long time for loading information. So sometimes when we're having a busy day, maybe we have back-to-back appointments, it's easy to rush. But if you know that person has some memory loss, just taking your time or trying to schedule some extra time to not rush them can really impact their experience. The next thing is watch for signs of change and offer accordingly, because every day can be different to them. Every day is different, even though it may be familiar to us. Nonverbal cues with individuals with dementia are the most important thing that you can do, because they may not be understanding what you're saying directly to them, but we always know the impact of how somebody makes us feel. So having a calm voice, being patient, being understanding, maybe holding their hand while they're going can greatly impact, again, somebody's experience. So as I wrap up, what I really want from you is to think of a case study example, especially if you've worked with an individual with dementia or suspected memory loss, because that's what we need. We currently have different sector guides for the business community, the faith community, the local government community. What I need from you today is an example, especially if you've had, had an experience working with someone with dementia. As I mentioned before, the story that I received from the dentist in Princeton really impacted me, because it's something you don't think about. So if you can write that down, I'd greatly, greatly encourage it, because we're gonna use that to help other ACT communities that are formed right now reach out to their local dentists or oral health professionals and really work to engage them in their community initiatives and efforts. So I'm gonna make you do a little work, because it's before lunch and we have to earn what we eat, right? So I have a couple questions that I'm hoping in a small group you'll be able to discuss. I don't know if we'll have time to share, but if you could please write down what challenges you're currently seeing or have observed working with an individual with dementia. If you had a positive or negative experience, what happened? And what are some warning signs or symptoms? What shocked me the most was the role the receptionists play, because they're the ones interacting with those people on the front line. Maybe it's the billing person, but we really want to empower you as the oral health community. So if you could just take 5 minutes to discuss, I'd really appreciate it. And then hopefully we'll have a little bit of time. I'm gonna give you actually 2 minutes. So do it quickly, because we're gonna share a minute at the end. So go, thank you.
So in our dental office, I'm a dental hygienist, and we have a lovely lady with dementia. She did just pass away last week. but we've definitely seen her progression over the last few years. Or like decline over the last year, I would say specifically, where we first started seeing her and there were little signs, but then the last few times it was like she was really sleepy, would kind of like yell and moan when we would clean her teeth, and we'd just feel so bad because we were there to help her, but you know, obviously she didn't know that. Her son was the power of attorney, so that was great because he always came with her. He always signed off on medical history, updated everything. Like, he was really thorough, but we've definitely witnessed, you know, elderly patients or dementia patients just be dropped off. And there's nobody to get a valid medical history from or anything, and that's sad.
Yeah.
It's really sad.
Thank you. Well, thanks so much for raising a valid point, because that's came up in other conversations. Possibly some caregivers looking for some respite and dropping somebody off at the dental clinic for a couple hours off, which is not something you maybe want to do, but it's something that you may have to start planning of a policy or procedure that's in place as well. So I don't want to keep you guys any longer so you don't miss your lunch, but does anybody have anything else that they would share, or anything that you would really like to see that could help you in your dental practice? If you look on the Act on Alzheimer's website, you'll find that they actually develop training modules for clinic care coordinators, because they realize that having a conversation, talking about memory loss, is really, really tough. And so if that's something that you feel is a need for your community, please let us know. If you included your email address, or if you're interested in being more connected or maybe providing more input, I would love to speak with you just to figure out what's needed. And I appreciate each and every one of you for what you do. If you have any additional questions, please come talk to me afterwards. And thank you. Have a wonderful rest of your day.